Hi, and welcome to Policy Unpacked, a podcast by Global Policy Network. In this series, we dive into the policy shaping our world, from healthcare to sustainability to education, and we explore how these critical areas intersect to drive meaningful change. Whether you're a policymaker, a practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. I'm Amina Gazal Sachi. I'm the founder and CEO of Global Policy Network. Today we have two guests who work for Global Policy Network, and they are both our fellows on our Medicines Roundtable series. Leslie Ipock is leading the first roundtable in our Medicines Roundtable series, The Role of Medicines in the 10-Year Plan, which took place last week. She is currently pursuing her degree in William and Mary University in Virginia, America, and is passionate about improving health outcomes globally through research and education. We also have James Malgwi, who is a licensed clinical pharmacist and seasoned public health professional with over a decade of experience in Nigeria's health sector. He has served both in the frontline and strategic roles across Borno State, supporting pharmaceutical services, reproductive health, and health supply chain systems. His current work includes leading health facility assessment and contributing to national and regional policy development. James is especially passionate about mentoring the next generation of African health leaders and ensuring access to quality care in fragile and underserved settings. And he's heading up our roundtable series in Nigeria. So, Leslie and James, welcome to the podcast. How are you today?
Hi, this is so exciting. I'm so happy to be able to join the podcast today.
Yeah, thank you very much for having us. And congratulations for the first roundtable. It was really amazing.
Yeah. Well done,
Yeah.
Leslie. And well done,
Thank
James.
you.
So I'm so delighted to have you both here. So Leslie, what first sparked your interest in public health, and how has your academic and leadership journey shaped your current focus on pharmacy, health systems, and policy?
So I haven't always been planning on entering the public health sector. When I started university, I was planning on going to medical school. So since I was in middle school, my initial plan was to go and become a pediatric pulmonologist. And so I wanted to go into pediatrics. And then my sophomore year of college, my second year, I took a global health class, and that sparked my interest. And so I started doing some more research into my own community. And the Virginia Department of Health, where I'm from, has been doing a lot of work recently for maternal and child health. And so that kind of started the bridge between pediatrics that I initially wanted to do and public health. So since then, I've started taking more public health classes. I changed my major at school, so now I'm a public health major. And then shifting towards pharmacy and policy systems was completely by chance. I became interested doing my coursework at William and Mary, but I haven't had that chance to really explore that area of the health sector until I became a fellow at Global Policy Network. And so this has been my first real exposure to getting to do that kind of work, and it's been really thrilling.
That's great to hear. And what about you, James? So you've worked across clinical pharmacy, health management, and now policy development. What's driven your career across those different roles, and how do you see those experiences informing each other?
Okay. That's an interesting question. I always get excited to answer that because my journey in healthcare is deeply rooted in my context, where I come from, which is a conflict affected and fragile system underserved population. So sometimes I used to tell people that I see my career like a pharmacist with wanderlust, trying to move from dispensing paracetamol to prescribing and implementing policy. So it began about 11 years, 11, 12 years ago with, managing patient treatment in a secondary facility. And then there I ensure prescriptions are served. Well, I was supervising about 20 to 20 something staff thereabout, and then I maintained the hospital's drug system. But it didn't take long. I realized that having the dispensing table alone will not solve the challenges that are at hand. So I began to, ask questions. I began to attend workshops, attend trainings and conferences just to find some answers to build my capacity. And to, you know, as time goes on, I began to search the internet to attend webinars and related to pharmaceutical system strengthening. And then I also enrolled in online courses. So from there, I gradually began to see that medicine availability, affordability, and their utilization is not just influenced, by I mean, it's a lot. It has to do with a lot. First off, it's influenced by systemic factors from broken supply system, policy fragmentation. There's a lot. So that led me to, to expand my focus and to build into pharmaceutical system and policy response. So each of these role build on each other. For instance, the clinical practice that I've had over years have taught me empathy and precision. Then my teaching roles, because at some point I was mentoring, some health professionals, so it helped me to communicate clearly and then to, you know, to be able to mentor future health professionals. And now in policy, I'm using those experiences to influence decisions that affect medicines at the subnational level. So I would say these experiences are not separate tracks,
Mm.
but they are interconnected layers. So, like I always say, you can't isolate medicine access from health systems. So, whether I'm, designing DRF policies or I'm supervising hospital pharmacy services in Borno State, I always carry those, voices of the rural doctor, that rural pharmacist or nurse, or health care worker with me. So that has been my passion, and I saw global health policy as an avenue to be able to make that impact.
That's fantastic. And Leslie, you're getting experience of leading projects and working with really diverse teams at GPN from, other fellows from around the world, the associates, and the fantastic system leaders at the forefront who are leading as advisors at GPN. So tell us a little about your experience as a fellow and what you have found to be the biggest learning points from leading on the first roundtable.
So this is my first experience really getting to lead on something like this. And so my biggest takeaway so far is I've really had to learn to push myself kind of out of my comfort zone. It can be really intimidating at times to be speaking with some of these like top leaders in pharmacy. But everybody has been so welcoming and it's been really enjoyable to work with everyone. Um, and it's been great to have this opportunity to put together a roundtable that has such an opportunity to make an impact on pharmacy policy in the UK, which was really something I didn't think I was capable of when I started this fellowship. And so this has really reinforced my confidence in all of my coursework and my training that I've had in university, while also building some new skills that I wasn't sure that I had before I started this process.
And James, you've led teams both at operational and policy level. How do you ensure that the realities on the ground shape strategies being developed nationally and globally?
Okay. So for me, I believe that policy should be informed by proximity to people. So it should start downward up and not upward down. So what I mean by that is, yeah, no one should sit at the center without understanding the reality on ground to just formulate policies. It should be proximal to the people. So in Borno State, where we deal with unique challenges, insecurity, displacement, infrastructural limitations. So it's easy for national or global policies to feel disconnected. So making a conscious effort to bridge that gap is very important. For example, while we were revising the Borno State Drug Revolving Fund Scheme policy, we involved pharmacists, store officers, community leaders, and end users. So that is how policy should be informed, so that we could be able to ask those questions. What works in real time? What bottlenecks persist, and how do we design systems that are resilient even in fragile settings? So I also draw from data that, were gathered during health facility assessment and quarterly supervision in hospitals. So this ground level insight fits into every strategic role that I play, and sometimes when I play certain roles, I reflect on some of these visits, some of these interactions. For instance, now when I'm currently coordinating the distribution of free maternal drugs within the state. So it's about bringing the field into the boardroom, if I will put it that way, and then ensuring decisions reflect the actual health system environment. With no power, sometimes you have to reflect on the realities on ground, no internet, and so many other things. So not just theoretical models. That is just what I'm trying to say.
And I absolutely love that, and that's what I love about Global Policy Network is that diversity. So that if you would agree with me, where we can sit with Leslie in the US and James in Nigeria and hear different perspectives of the health systems and the challenges that they have locally and the opportunities, and also the things that make them very similar as well. So James, coming back to you, so you've worked with many different people at GPN, fellows, trainees, advisors, all from around the world. What do you think are the most critical gaps in the healthcare education system today?
Well, that's a very interesting question because it's I would say it's very vast, but I will identify three or four. For instance, actually the gaps are multidimensional. I'll put it that way. You know, there's a disconnect between academic training and real world health systems. That's one of the things I discovered, and then the interdisciplinary approach, where or if I will put it in other words, this collaborative approach to health systems. There's also that gap in education, that gap in leadership and advocacy. There are times that the classroom, the four walls of the classroom doesn't give one that advantage. So, but I believe that that's one of the reasons why fellowships exist, global policy network exists, so that you can be able to develop some of these advocacy skills, to understand health system and to be able to make impact.
Thank you. And Leslie, from your lens as a student and an emerging leader, hopefully, where do you see the biggest disconnects between education and the real world demands on public health leaders?
I think part of this James has already touched on, but I believe that many of the public health programs in universities, especially in the United States, are focusing right now more on the numbers than they are on the people that they're helping. And there's this big disconnect that's being fostered in our coursework as young professionals, where we're focusing so heavily on the statistics and the epidemiology that we're forgetting about the people and why these statistics are existing and why we're studying them in the first place. And so I think there needs to be more of a focus on embedding students in the communities that they're learning about so we can start focusing on why it's important that these statistics are happening and what we can do instead of just looking at the statistics, studying it, taking our exams, and then moving on from there. Because this disconnect is growing and growing and growing. And I believe it's also starting to factor into some of the health disparities in our communities, where these young professionals are coming out of school and they aren't quite understanding the why behind what we're doing. They're only grasping the what.
Thank you. And for both of you, what's something you've learned from working alongside people at different career stages or different sectors? Leslie, would you like to go first?
Sure. Yeah. So I think the biggest thing I've learned, especially at GPN, is there's always something I can learn from someone, regardless of their career stage. And I think that might just be special to us because we have such a diverse network of people that we're working together with. And so I've found myself in particular paying close attention to different leadership styles from people I'm working with, as I find that's the area that I personally have the least amount of experience and where I can grow the most. But all of us have different strengths and weaknesses. And regardless of where we are in our career, there's always something we can learn from each other.
Thank you.
Yeah.
Yeah.
So for me, I see innovation and experience as complementary. They are not mutually exclusive. They should be complementary. So while we interact with senior professionals as they try to bring the historical context, just like Leslie mentioned about epidemiology and all of that, they bring those historical contexts, system memory, institutional knowledge, which are very important. Then there is this younger generations of professionals that are now bringing that new energy, technology, fluency, fresh perspective. That's for instance, if I mentor students, I like early career pharmacists, I often see how their ideas normally challenge the traditional norm, the traditional approaches, just like Leslie just mentioned. So it forces me to reflect and sometimes rethink that. Well, it's good to rethink the established practices as well, and then at the same time to help them to ground their ideas in the complexity of the local context. So theory with feasibility, it's something that should be, we should gain as we interact with professionals.
That's fantastic. And lastly, you're from the US and you're working on a policy roundtable on the UK health system. So, what have you found the most surprising or something you've had to really adapt to when you're looking at a different health system from your own?
I think this experience has truly just shown how different these two systems are from each other. Just yesterday, I was on our fellowship workshop with Stephen Riley, and I had asked about the whole idea of being able to just approach a pharmacist and get a prescription. That's kind of a novel idea, at least for all of the pharmacists in my area. You have to first usually wait a couple months to get into a primary care practice, and then you get the prescription. And then, like at my local pharmacy, it's typically anywhere from like a 30 to 45-minute wait just to pick up your prescriptions. You're not talking to a pharmacist at all. You're just there to pick up your prescriptions. And so Stephen Riley mentioned that oftentimes it's like a 15-minute wait to see the pharmacist and you get your prescription, or they'll ask you to come back later to try and keep the wait times as low as possible. And I think it's interesting just to get to witness how efficient these pharmacies are, because it's something I've noticed that we really struggle with in the States. So I think this idea of collaboration could definitely be something that we could use here in the States to hopefully get those wait times down and make pharmacy more accessible for everyone.
And James, what does strong collaboration look like for you when you're trying to solve some of the systemic challenges in your local health system?
And one of the things that will make the health system work is for every of the building block to be able to connect with each other. Like I said, governance structure, finance, health information and medicine access, and innovations or technology, the workforce. So the goal for each of these players should be the same. And what is that goal? To improve access, to and of course better health outcome. So for instance, working with logisticians, in the health system, working with public health officers, community leaders, IT professionals, so to me, pharmaceutical system is not just a pipeline of products, but more, as an integrated system that speaks to almost all of the blocks within health system. So each of these system is important, and then strengthening medicine access requires that we should be able to blur some of these professional boundaries as pharmacists or as public health professionals or as IT professionals. should be able to blow the boundaries. We should be able to, get in touch and then to be able to build coalitions that cut across sectors. So this is what strong collaboration is to me.
Thank you. And let's talk about the fellowship in a bit more detail. So, Leslie, what has being part of the GPN fellowship taught you about how policy is made and how younger voices can shape it?
I think being in the fellowship has really broken down the barrier to get into building policy. I think, in particular, our roundtable series is a great way of kind of breaking through that barrier, especially as a young professional. Before being a fellow at GPN, I haven't ever attended a roundtable. And I think that they're a great way for younger people to listen, learn, and then get excited and get involved in policymaking, and being able to help out on this first roundtable and now preparing to write the policy brief. I've already learned so much in such a short amount of time and what it takes to make policy, and then also the collaborative aspect of it behind the scenes that I don't think a lot of us kind of realized is going on. So it's really exciting.
And James, as a GPN fellow, how do you see platforms like this fellowship contributing to more effective and inclusive health system policies across Africa?
Okay, yeah, like for me, I would say, the GPN represents a space that values, evidence and inclusiveness, or I'd say inclusivity. For instance, I'm talking to you right from Nigeria, Leslie it's in the US and you're in the UK. And, I've seen an area of available information that normally I would have no access to. So this is what GPN has exposed me to. And I see that if for GPN, the mentorship is not just a formality. It is very deliberate, it is intentional, allowing people to discover what they can do and then to push them beyond their boundaries. I mean, stakeholder engagement is something that I am really seeing it in a very new light. And if in Africa, if we can be able to have this, kind of engagement and stakeholder involvement in our discussions and conversations, I believe that we will achieve a lot. So GPN has given that, that platform that I see, if a lot of African leaders and health professionals can key into the such conversations, I believe that a lot will be coming out of it. And I mean, there are a lot of experienced professionals, a lot of it, and that excites me a lot.
And for both of you, we've spoken a bit about what it's like working with different people, especially different backgrounds to your own. What's one insight or shift in perspective you've gained through your work at GPN?
I think something that has really given me a shift in perspective is just working with such a diverse group of people and being able to ask a bunch of different questions and see what different people think based off of their experience in pharmacy or policy. And then working on UK policy in general has allowed me to take on a new perspective on the United States policy back at home. And I think this has allowed me to learn and grow a lot more than might have been possible if I had just taken on a role in the United States.
And
Yeah.
James,
So for me, I see that the shift is a lot to do with the kind of ecosystem that GPN has provided. It's a different ecosystem. It is not just a one-way communication platform. So whether you are a student, whether you're a policymaker or you're a frontline worker, I mean, you have something to contribute, and there's a lot also you will learn, and you could see how you could be able to formulate the pressing questions. You can see how policy thinking, or system thinking, it's evolving and all of that from people. So it's really impressive, and I'm excited about that.
and Leslie, what do you think has been the biggest learning curve for you at GPN?
I think, particularly with my role as leading on these roundtables, the management aspect of things has been quite a big learning curve. My previous leadership roles weren't in like a traditional, more corporate setting. So this has been interesting to get to kind of learn and grow in that aspect, whether it's delegating tasks or sending out a bunch of emails. I've kind of had to learn and grow as I go, which I think is really exciting.
And James, what attracted you to Global Policy Network?
Okay, so like I mentioned before, I was looking for where I can be able to explore and then, find myself grow in policy thinking, policy analysis. And I found global network policy to be very interactive. And well, currently for the medicine policy series in Nigeria, I mean it's a whole lot from putting the Nigerian team together, identifying those stakeholders and then raising those pressing questions and who to answer them. It's something that I've never done, or I would say I've not seen it in this way. And I mean, global policy network it's truly different.
Thank you. And Leslie, Stephen Riley gave you a shout out on one of our episodes of Policy Unpacked. How has it been working with people that are so well respected in the pharmacy world?
It was definitely really intimidating at first. I remember during my first week when we had, I think it was our first meeting with Stephen Riley, I like called my parents directly afterwards and was like, you will not believe who I just had a call with. But everybody's been so welcoming and exciting to like answer questions and mentor all of the fellows here at GPN. So I feel like I've very quickly been able to like come into that role and feel more comfortable contacting people, whether it's reaching out to people on LinkedIn or sending emails. And I'm just incredibly grateful to have that opportunity to be able to speak with these leaders. And I think it's an opportunity that most people with my role and my age and my education would never have. So I think that's one of the special things that we have with this fellowship is having access to people like Stephen and Yusuf that are able to answer questions and teach us. And we have so much that we can learn from them too.
And James, what advice would you give to experienced professionals like yourself who want to mentor or work more closely with the next generation of leaders?
Okay. My advice is to be present, to offer real support, and to share opportunities. Young leaders well, I would say I'm also a young leader, so but I'm just opportune to also have people I'm mentoring. So I would say young leaders like myself, one of the things or some of the things they need access, they need affirmation, they need accountability, and mentorship is a two-way learning process. You could learn from even those you are mentoring, about emerging technologies, about community dynamics. I mean, even how to communicate effectively with, younger audience. It's something that you should be able to pass on to, those that are coming behind. And then I want to also believe that if this kind of interaction takes place, then the next generation that will lead systems, they will be able to do that in ways that is unique and more precise if the experienced professional will prepare them and not just supervise. So I believe that strongly.
And James, what can people expect from you and your work at Global Policy Network? Because you're due to launch the policy roundtable with the team, the Nigerian team. So what can they expect from this fantastic work that you and the team are doing in Nigeria?
Yeah, I mean, they should expect a lot. They should expect collaborations. They should expect dialogues that challenges the thoughts and the traditional approaches, because the series will bring together multiple stakeholders to unpack policy, to challenge assumptions. There are a lot of assumptions that are, sometimes we think we know until the conversation starts. So these are some of the things that we want to challenge assumptions, and we want to develop grounded and actionable solutions. So people should expect, policy to be really, really unpacked, especially when it has to do with the Nigerian ecosystem in terms of supply chain, health system, health system strengthening. So we will not just be talking about medicines. We should also, expect talking about, livelihood, resilience, and all of that. So there's a lot that is in the pipeline.
And lastly, what would you say to young people who are eager to make a difference in public health but aren't sure where to start?
I think step one's being brave. And then there also has to be a little bit of like internal reflection about what's important to you and where do you think that you see yourself making a difference. And then I would start looking to see what other public health leaders are doing in that role and reaching out to them via email, LinkedIn, and seeing how they got there and what they're excited about and what they see themselves doing and seeing if you can get involved. And I think being being ready and able to step outside of your comfort zone and maybe take on a position that you didn't previously see yourself in. I myself didn't expect to be leading roundtables, but I found it to be incredibly fulfilling and I've learned so much from it. So I think being brave and then reaching out to people is the key to really finding your place and knowing where to go from there next.
Now we're going to go to the quick fire round. So, James, tell me about someone, whether it's a person you know or even a public figure that has inspired you.
Yeah, for me, someone that's always inspired me, even though she's not a pharmacist, but or a health professional, she has a very powerful blend of technical depth. She has very wide policy insight and leadership that has global impact. Her name is Dr. Ngozi Okonjo-Iweala. She's currently the DG of World Trade Organization. She's a trailblazer and she has inspired me a lot.
Amazing. And we would love to invite her to the podcast. If you're listening, tell us.
I hope she has the time. She's very busy. So,
I bet.
yeah.
And Leslie, tell me about a book you would recommend that aspiring healthcare leaders read.
Oh boy. I think reading as much as possible is great for anyone. I just started, actually last night, I just started reading Everything's Tuberculosis by John Green. And I'm only a couple chapters into that, but it's kind of taking a glance over like the historical route of tuberculosis and how people have managed it over time. And that's been an exciting read. But I think it's fun just to read books like that I have experienced. We are still testing for tuberculosis in the United States consistently. And then I've enjoyed reading like a lot of books recently just about women and the STEM and healthcare medicine field. So any of those books I would say are great.
And James, if you weren't doing the job you're doing now, what would you be doing?
I would likely be into education or research. I've always wanted to do that. Well, it's still kind of building systems, but through knowledge production and capacity building. So it's something that I would love to do. And I like journalism as well. I always want to, ask people questions. I want to get interactive with people and all of that. So maybe either into education, academic research, or journalism. Any of it could have been good for me.
And this is for both of you, but Leslie, I'd like you to go first. So, who would you like to give a shout out to come to a future episode of Global Policy Network's Policy Unpacked?
Ooh. I would love to have more of our fellows in the future come on and be able to chat with each other. I think it's a great way for us to kind of examine how much we have in common and what we can learn from each other and to expose each other to hopefully a lot more of up and coming leaders, whether they're listening or tuning in via LinkedIn, YouTube, So I think getting more of our fellows on here, I think this is an exciting opportunity for James and I hope that will be extended to more of us in the future.
And James, your turn. Let's go to you. Who would you like to give a shout out to?
Yeah, well, let me speak from my own context. I would want to have someone from the National Health Product Supply Chain Management Program in Nigeria, because we're talking about supply chain in our medicine series in Nigeria. So if there could be someone from, that to, give some tips into what Nigeria is currently doing, that would be helpful. So, and maybe some few innovators, like you mentioned earlier during one of our meetings that we had with an organization that are, innovating access. So maybe someone from there that would do well. And of course, like Leslie has said, more of our fellows.
Absolutely. We must have more of them on the next episode. But this
Yeah.
brings this particular episode to a wrap. So James and Leslie, thank you so much for joining us today. Is there anything you'd like to add before we say goodbye?
I would say if people are listening and they're interested in learning more, to keep an eye out to join both of our roundtables that are coming up. So I know James and I have been working so hard on those, and we would love to have as many voices as possible on those. So keep an eye out on our website and our LinkedIn to learn more.
And
Yeah,
James,
I would also say don't be left behind. Join the conversation.
thank you so much both. And I agree with you. For our listeners, go onto our website, read about our policy series, and join us. Join us to listen to our next episode, or follow us on LinkedIn, Instagram, Facebook, and TikTok. And feel free to drop a comment below as well. So see you all next week. Take care. Bye-bye.
Yeah.